Um, Good afternoon, everyone. Thank you all for finding time and joining today's webinar on promoting mental well-being on vulnerable and marginalized populations amid pandemic stress. My name is Drisha Pathak, and I will be the moderator of today's session. Before we begin the webinar, I would request Dr. Ash Pichori to share a few words with all of us and invite and welcome our speakers. Thank you, Dr. Ash.
Thank you so much, Drisha. A big warm welcome to everyone. This is really like a family reunion in many ways, and I feel so grateful for this. Thank you ever so much for being here. But what I also want to say is that it's very special and a great privilege to have this opportunity here today. I believe one among hopefully several. Just to give you a little backdrop, the idea really was, it started with several conversations. I know that we've had multiple conversations with many of you who are here with us today, where we've spent time with communities in this period and learned that certainly all of us are challenged with this period of pandemic, but particularly those who are most vulnerable and marginalized are ones who are further marginalized and creating much more vulnerability among the communities that we've spent literally our lifetimes working with. So it's sort of a very important moment to come in, step in, and give back. And so through multiple conversations with communities, offline, online, formally and informally, a range of discussions, several exploratory conversations have taken place over a period of time. We'll get glimpses of some of those conversations over the course of the next 60, 90 minutes that we spend together here. But what I want to say is that the idea really is that we bring in strong advocates for the community to be able to build up to a response which ultimately will not only serve the community, but hopefully in the course of time also empower the community and serve as sustainable solutions. And certainly this whole field is new to us because this pandemic is something that's so unprecedented. But this is a process, by no means can be achieved with a single conversation. So that process has begun, and this is a critical part of that process. And I just want to say a big warm welcome to all of you and thank you very much for being here and being part of this very critical process. And I also want to say that while we get to listen in on some of the voices that were captured over the course of this last some weeks and a month plus, we also have some of the people we've spent time with among the communities that that are most vulnerable and marginalized, who will join us between Zoom and Facebook. So those who are unable to join us on Zoom are going to link in with this conversation via Facebook. And again, I want to say and underscore that it is a process. So by no means do we assume that we'll be able to achieve anything substantive in a single conversation, but I just want to say it is a critical step. And so your voice really counts. And I just want to say that all the people from the community whom we've had the pleasure and privilege of engaging with will get feedback. So there will be a loop, and then we hope to build up to some more. So with that, I just want to say a warm welcome again to the family. This is an honor and a privilege. We're hugely humbled, and I know that this is the start of something much bigger. So thank you again, and really looking forward to every minute that we get to spend together today and always. Thank you.
Thank you, Dr. Ash. Like you said, this is a very critical step, and we hope to build up to something more. Now I'll begin with the session, and I would like to invite Ms. Sarita Jadhav to give her insight into the topic of impact of COVID on key populations and mitigating the actions that are needed. Sarita Jadhav is a development specialist with more than 20 years of experience in public health, strategic planning, coordination, program management, research, advocacy, and partnerships in United Nations, bilateral and international development agencies. She possesses technical expertise on sexual and reproductive health, gender-based violence, HIV/AIDS, with a particular focus on human rights, gender, and young people. She is a National Program Officer in UNESCO New Delhi office. She has a master's degree in social work and a bachelor's degree in law from Utkal University, Bhubaneswar. Miss Sarita, please.
Yeah, thank you, Ash, and a very good afternoon to all our my co-panelists. It's always a pleasure working with Ash and his wonderful team. And I think what is really important is the topic that we are all going to discuss about and today in our webinar. And what has been asked of me is that I should talk about the impact of COVID on key populations, and also suggest some of the steps that one could take to mitigate the impacts. I think everybody has been talking about COVID, and we all know how the country has been affected. Uh, our industries have completely broken down, and the world economy, in fact, is in a complete confusion, disarray. And when we talk about the communities that are being highlighted in our webinar today, uh, it's very difficult when people say social isolation, physical distancing, all these things, especially when we know that the virus is so extremely contagious and infectious. I think these things like social distancing or physical distancing, they cannot be maintained. In a house where you have 6 to 7 people living, how are we expecting them to maintain social and physical distancing? Everybody doesn't live in a 3 BHK or a AC room, so it's very difficult for our communities. When we talk about migrant workers, we have seen in our television about the plight that our migrant workers have gone through. I mean, millions of migrant workers traveling across the country to their hometowns, to their villages. It's extremely difficult, and it's extremely heartbreaking to see the trauma of these migrant workers who contribute a lot to our economy in our cities. Some of the NGOs, they have been trying to do work and trying to organize some support for these migrant workers, but the numbers are so massive that it is very difficult. We are also talking about domestic workers. There have been surveys which have been done, and there was a survey which was done among 140 domestic workers in Gurgaon and Delhi, and only 20% said that they had received salaries. And some of the gated communities, they wanted these domestic workers to come and work for them, but the community, the RWAs, they never allowed them to come and work. So right now, these domestic workers are also trying to organize themselves, have their own manifesto of demands to ensure that the owners, I mean, the rich and the middle class people, they think that some of these domestic maids and servants, they will get the infections, but they don't travel abroad. They have their own hygiene. So it is right now empowering these domestic workers and ensuring that they demand of their owners, their masters, that they use precautions. There have been studies which have been done in 200 gram panchayats, and where migrant workers, uh, 30 uh, 30% of the migrant workers said that they don't want to go back to Mumbai and Delhi, because they are hopeful. They are saying that we would rather work in our villages, and we don't want to go back. We have already seen the assessment, the review of the FGDs that the Center for Human Progress has done, where you have interviews, where you have focus group discussions with some of the people from the LGBT community, with sex workers, with truckers, with migrants. So everywhere there is a very big issue. So we have been hearing about it. And I think also to add to the confusion, media, which is considered as a very important pillar of our democracy, they have been further dividing people. There's so much of wrong information. There is so much of false information that is happening. I think it is, what is really important is that we Together we find out solutions which are doable, which are feasible, and which may sound optimistic, but at the same time they have to be realistic. We have to be very that. Some of the ideas and suggestions that come to my mind when we are talking about key populations, especially, and I've had this discussion with Ash and his team before, I think is very important when we talk about alliances and partnerships. I think there is great power in partnerships, whether it is with NGOs, whether it is with community-based organizations, whether it is with the government. I think those alliances and partnerships would be very, very beneficial. And it is easy to say that, okay, have partnerships, have alliances, but is the community, are the communities that we're talking about, do they have the capacity, do they have the means, the knowledge to reach out and develop these alliances and partnerships? If we want to say that, okay, it's a line ministry for social justice and empowerment, if we are expecting somebody from the transgender community, or if we want somebody to access a woman who's into sex work, to access some schemes which are being implemented by the Ministry of Women and Child, does she have the information? Does she have the know-how of how do I reach out to these ministries? How do I know? Also, I think there has to be greater collaboration between all these different community members. There has to be greater information sharing. We have to have, I don't know how we are going to do it, but consider, like, I think it's a wonderful thing, Ash, that the communities have reached out to you, that they have shared about their concerns with you. And now how do we respond collaboratively? Because this is not this is not normal. It has affected people, it has affected their health, it has affected livelihoods, the economy is completely affected, girls are being affected, the vulnerabilities have increased, there are severe concerns being raised. I know this webinar is looking at key communities, but there is a lot of concern being raised by the government, NGOs, and everybody, saying that post-COVID, when the lockdown is completely lifted, girls may not come back to school. They might be forced to drop out. There will be forced migration, and many of them might be trafficked and then forced into sex work. So I think these are some of the critical issues that, one could think about and see how do we work together with the government, because as an NGO, as the UN, as the government, I think none of us can, we don't have a magic bullet or a solution for everything. But yes, as I said, there is great power in partnerships. So we could all work together and see how do we tap those resources? How do we link the smaller communities, if they are not a part of a community-based organization or an NGO or a network? How do we help them to be a part of that, despite all the differences, and say that, look, we all are having problems, whether it's emotional health, whether it's mental health, whether it's depression, anxiety, trauma. How do we help the other person to overcome all that? And this does not happen only in people who belong to a certain class or cadre. It is cross-cutting. We see people who are in very good positions, but they are also undergoing depression and they have the host of issues. So I think partnerships is very, very important. Second is advocacy. How do we advocate with the government, with our political leaders, with our legislators, and say, because every member of parliament, I mean, all of you are aware that, we have MP LAD funds, which are called local area development funds. How do we reach out effectively to them to sensitize them? A lot of you know about advocacy. Abina is there, and she's advocated extensively on some of the human rights bills, acts, etc. that we have in the country. So how do we advocate with the political leaders? Because we can't just say that, okay, they know about our issues and there is complacency, they don't want to do about it. How do we advocate with our bureaucrats? How do we advocate with our policymakers? And I mean, the tools that we need to make, the information, whether it's through information booklets, whether it's through one-page flyers, to tell them that, I mean, these people are a part of our society and these are the needs. So advocating with political leaders, with my little experience of working on political advocacy when I was in UNAIDS, it has helped greatly, where we used to talk about the needs of HIV positive people. So many of the political leaders had never ever interacted with communities. They didn't know what the issues were. So yes, of course, and capacity building, that's also important, that we work with the communities and get them all together, mobilize them to voice it out, because sometimes there is a lot of there are communities, there is a lot of people not speaking with the same voice. The needs may be the same, but everybody is in fragments, so we need to bring them together. So these are some of my initial remarks, and I hand it over back to you.
Thank you, Ms. Sarita. Am I audible? Yeah. Thank you so much. I think the ideas that you have shared, the suggestions that you have given are very important, and we will try to better put them together and forward it to the NGOs and the communities further. Thank you so much. Now I would request Ms. Abina Ahir. Are you there?
Yes,
Yeah.
can you hear me?
Yeah.
Okay.
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 I just
Great.
wanted to check your connection.
Yes.
Thank
Can
you.
you? Okay.
Yeah, she'll be speaking about sexuality, gender, and rights. Ms. Abina is one transgender activist of India and has been instrumental in trans movement, empowerment, and addressing core issues around family support. With the help of her mother in her career, she has worked with organizations such as the Humsafar Trust, Family Health International, John Hopkins University, Center for Communication Program, and India HIV/AIDS Alliance. Professionally, Abina is a master's in NGO management and social entrepreneurship and software, and also a software programmer. She is serving International Trans Fund as starring committee member to ensure and create resources for the transgender communities across the globe. She is also part of innovative reference group on transgender women IRGT as vice president working on HIV AIDS advocacy and human rights issue across globe. She has been part of various documentaries and also participated in TEDx talk in Delhi and Varanasi. She has also been awarded in 2014 as RDX Awardee Fellowship for her work towards trans empowerment in India. Ms. Abina?
Thank you. And thank you, Ash, for providing all the additional information that you're putting it in chat box. I think in my initial remarks, I just want to, first of all, I just want to give a big shout out for the great points that Sarita has talked about. I think all her points that have been talked about is very true. And when she was talking to me, I was really going and understanding about all these years the activism that we have been doing with especially UN system within the political arena. What I have realized over the period of time is that many times it is important for them to see community because they haven't seen community. For them, the references of the communities are very limited to the communities who are begging on the streets or creating nuisance to the society and all those. That's their initial perceptions. They all say that many times when a person will do 1,000 good things, but one bad thing, people will remember that person for those particular one bad thing. So within the communities also, when we talk about it, is that when we talk about key stakeholders and other people who are specifically remembering the community, they will, for them, it's always the communities who are part of the drug users community, or women in sex work, or transgenders, or men who have sex with men, or people living with HIV. There is an amount of acute stigma that is carried within those people when it comes to understanding the issues. The bigger part about it is that unfortunately the key communities are not part of the response. They are part of the service delivery, but they are not part of the response. Response, what I mean to say, is that none of us are actually there sitting with the key stakeholders and policymakers who are receiving it. So what happens is that whatever policy is being made, it is being made You just have to abide by that rather than actually influencing to the entire fact. I will just give an example. Like for example, when we talk about the transgender Nalsa judgment, we worked for over a decade on making sure that we managed to get a historical transgender judgment, which has been reflected in various countries, including Nepal, Pakistan, Bangladesh, and also in other countries also. But when it came to actually creating a bill for transgender community, the government of India referred to the Australian intersex bill and tried to ostracize the entire community by zeroing it down the transgenderism or gender identities to the genitals rather than an identity or an expression for people. There's a very little information that is available for the about the entire community within the key stakeholders. As a result of that, the transgender bill that you talk about, it is quite heavily heavily loaded towards the Hijra community, but it doesn't talk about the transgender men. It doesn't talk about the other identities like Aravani, Jokti, and other people. And it doesn't talk about specifically around gender diversities within the transgender community. What I'm trying to say to you is that uh, stakeholders and key stakeholders and key policymakers choose what they want to believe about the communities. The other point that Sarita talked about it efficiently is about that we don't come in black and white, but there's a different, each community within the community also there's a huge amount of diversity, and it is not possible that everybody will agree to all the points. I'll give an example. On 15th April 2014, we managed to get a judgment from the from basically Supreme Court of India, which says that is transgender people has to be acknowledged as a third gender. Now the problem happened is that within the transgender community also there was a consensus about how they want to be identified. A bunch of people were saying that is, oh, we want to identify it as binary, either male or a female. We don't want to be considered as a transgender separately. Some of us debated about that, which is what is third gender. What does that mean by who's the first gender and who's the second gender? We defy that. We don't work around with those policies, and we work around with that. So I'm just saying is that reaching to a consensus and agree to disagree is the biggest problem that we have. For years, we had a separate movement for trans women and trans men. They were not sitting on same platform and talking about their issues at one length and in uniform voices. So it required a major work. It required a major amount of activities and initiatives to make sure that these people come together and they actually start together discussing about commonalities which needs to be addressed. So it's a big Herculean task when it comes to perspective about that. The third thing that Sarita talked about is that we still don't have enough knowledge. As much as the policymakers don't have knowledge about the key communities, we also still don't have a complete knowledge about policy making. To be precisely, there might be so many schemes which are applicable to the high risk communities and minorities and other people, but we don't know how to avail them. We don't know whether we fit into those schemes or not. There is a larger issue about getting the things done which is required for these schemes to be availed. And because of the lack of knowledge, because of the lack of access to this access to the documentation or other things, we are not been able to create a very strong response through which we will be able to avail those schemes. So these are the larger problems that we are right now facing around with that. But the biggest problem that I'm trying to talk about is that the other larger issue that the community is facing immensely, especially around mental health. It's something I want to highlight about. When in countries like India, mental health has been always been stigmatized immensely and not been able to address appropriately. None of the policies, none of the services, none of the guideline talks about elaborately around emphasize around mental health, depressions, and acute kind of illnesses which require to be there. We have huge amount of hospitals to treat cancer patient, other people, but a lot of people are could be extremely suicidal because of the mental health depression, and a lot of us are not paying enough attention to that. The communities which are from the high risk communities are way much more has higher vulnerability to these aspects because the kind of lifestyle they live through, the kind of stigma that they face, the kind of issues that they face within the community and outside the community from their own blood relatives, family members, about rejection, about discrimination, multi-layer discrimination. In fact, Ashok Rav Kavi, who's also a very famous a gay activist and also somebody who started Humsafar Trust used to always talk to me about the stigma onion, which means that you peel one layer at time and there's another layer of stigma which is already there for high risk community, which people don't understand and which we don't manage to kind of tackle around. I think while working with the UN system, many times, and Sarita has been part of the UN system as well. When we talk about working with UN system, UN aids and other things, they have to balance the act with the government. So many times they can't take a bold stand. It is expected the civil society should be taking a bold stand when it comes to making policy decisions or creating some enabling environment for the key communities. But when it comes to the systems which are supposed to be in advocacy, because of we don't have enough resources on advocacy, or because they are UN system and they have to balance with the within the government system, they don't manage to outspokenly talk about an important aspect which is affecting the key community. So those are my larger perspective that I just want to put it across when it comes to working with key communities and other related aspects. We still struggling with issues related to access to health. We're still struggling with issues related to the policy reforms. We're still struggling with the issues related to mainstream inclusion and mainstreaming of the issues. We still been secluded from the society as being part of the high risk community, and we're not being treated as an equal ground. So those are the larger aspects that we must work around with. And of course, there are issues around other structural barriers like gender-based violence, mental health, stigma, discrimination, which needs to be also, be part of the policy decisions and that should reflect within the policy framework as well. And that requires a larger advocacy.
Thank you so much, Ms. Abhina, for sharing the content on issues for the gender and equality of communities, giving reference to the communities are very limited and have initial perceptions, as key communities are not the part of the response and most of them are unaware. Also talking about the multi-layered issues that are the root cause of the mental health issues among the community members and that are to be addressed and should be talked about. Thank you so much. Um, Now, moving on to the next session, I would like to invite Dr. Kalpana Apte, who is a Secretary General of FPA India and has been working for the last 23 years as a development professional in public health, particularly sexual and reproductive health and rights, and family planning in India. Areas of her experience include planning and implementing clinical and community-based interventions that deliver health, particularly sexual and reproductive health services, addresses stigma and discrimination around abortions, HIV/AIDS, sexual orientation, and also interventions aimed at gender equality and equity, including strategies to mitigate gender-based violence. Her particular interest and skills are to conceptualize and implement large district or block level SRHR, including family planning interventions that deliver results. As a program team leader, she has led FPA India teams to develop 2 strategic plans in the year of 2005 to 2009 and 2011 to 2015, and have been responsible for ensuring developing aligned annual activity and budget plans and its implementation, led the donor-funded projects development and implementation. Dr. Apte, over to you.
Thank you, Drisha. Thank you for that kind introduction. We have had some discussion already, and we are still talking about issues which. So, having been in this field for decades, sometimes I feel that, the more things change, more they remain the same. I mean, sometimes I feel a little bit that will I ever see a time where we would talk also about a lot of triumphs and wins? Having said that, let's just discuss the issue around sexual and reproductive health services for various communities that we have identified for this webinar. One thing which we must remember when we talk of clinical services that all these communities together as a response to a crisis which we all know a couple decades ago, And then from there, really the empowerment evolved, and today we have a lot of knowledge and understanding. And I would like to borrow a little bit from what Abhina has said, that the lack of knowledge and even I would say the lack of understanding amongst the larger communities and stakeholders, which actually is the root cause for lack of services or lack of access to services for a majority of these groups that we are discussing. So let me just elaborate, and I will first start with not really clinical work, but then let's also understand that sometimes even the language that we all very simply use can be misleading, or can be it may not be the appropriate language. And again, I mean, I keep saying this, that I absolutely don't feel comfortable saying the third gender when we are talking of trans persons, because that begets that there is a second gender and then there is a first gender, and there is no guesses, no prizes for guessing that which would be the first gender, and that itself we are setting ourselves to fail. And from if we very simply, and I've seen lot of experts and lot of people who mean well using terminologies which are going to set us for failure in future. The second thought that I keep having, that communities have different needs and different clinical, one can say, issues which require solutions or treatment or management protocols. And therefore, a trucker, a truck driving migrant men will have different clinical problems or STIs or issues which will require a certain kind of specialities. Trans people will have different issues for which they will need medical expertise, and sex workers and women in sex work will need different kinds of, because of their biology. And I would like to hear quote someone very Yuval Harari. You all know, we've all read him, and he says very famously that biology is actually enabling and culture actually restricts. And therefore, we all, the service providers and the clinical protocol makers and people who basically define very high quality medical setups, all come from a base that is the community base. We all belong to one or the other community. And therefore, I go back to the roots and I say that in the medical curriculum, we need to enrich our in college curriculum to add these specialities. While clinical needs for women sex workers or migrant men or truck drivers or others probably are part of the medical curriculum, or that is much more relatively simpler as the clinical protocols go, and the barriers there are more cultural or more you can say mental blocks. Whereas there may be newer needs for medical protocols for trans people, and I will quote one example, and that's hormone therapy. Hormone therapy, long-term impact on liver, safety issues, all of that, enough time will have to go, and we will need to have those kind of research papers, those kind of protocols which keeps our people safe and provides that kind of confidence to doctors who are providing it. I'm not saying hormone therapy is not safe. I'm saying that we require more information and better understanding of nuances of it. That what body mass index, how long, is there a need for a break in between? These are all questions that doctors, and they all have so also the understanding that many times the doctors would like to do good, and they need information to make it safer for their patients or clients, because these are not sick people. We would need to then have a dialogue of both these communities, because then the community thinks that doctors are putting barriers in my treatment protocol. They are becoming difficult. They are becoming they're becoming closed. And I think that kind of dialogue is very important for us to come to a similar pace, so that access can become broader. So these are some of my thoughts that we have OPDs across our branches for all specialized services. And therefore, our learning, we keep learning, we keep understanding. And one thing, the rule of thumb is that stigma-free, open, and equity-driven service delivery really helps everybody, the doctors as well as people who walk in. And at the end of the day, we all have to remember one basic thing which we keep kind of forgetting, is that we are all human beings under every other identity that we have. We are all human beings, and we all have a human right to be treated with dignity and consideration, privacy and respect. And if the medical fraternity understands this, and they do, like I tell you that they do, what they need is better clinical protocol, understanding, and a broader dialogue. I think we would be able to do much more. We need to go to the roots of these systems, and we need to kind of strengthen the system to be able to deliver these clinical services. And the last thing that I would like to speak on this webinar is about sexual health. Our own, and I don't tire of saying that our own understanding collectively as a community, as passionate people, advocates, and people who work in this, of sexual health is very, very limited. It comes from a disease perspective. It comes, so whenever you will talk about sexual health, people will immediately either talk about various ways to have sex or infections. And I think this is doing a disservice to a broader health contingent, that's sexual health. And I think we owe it to ourselves to look into these issues very closely and find, or maybe even create opportunities for counselors, doctors, countless people who would want to be part of this progressive movement to deliver on these clinical services. We had a discussion a little while ago about mental health. Imagine a counselor who is dealing with mental health, who is not well versed with the sexual health issues around all these identities. Unless we bring that understanding, that work of that counselor would not be complete. And therefore, we owe it to ourselves, to our systems, and to our medical fraternity to be able to do this kind of academic fundamental work. All other things that we are doing are fantastic, but we now need to go and also look at all these communities from the perspective of their unique needs and respect those needs and find solutions for that. So I will stop here, and if there are any questions, I would be happy to take. Thank you.
Thank you, Ms. Apte. As we have only few community representatives, we are not taking questions right now, but as soon as we get questions on Facebook or so, there will be a discussion session. We will try to lead those questions there. Thank you so much. Thank you so much for sharing your valuable insight on sexual and reproductive health interventions for communities and covering issues like clinical services, lack of knowledge, and language, most importantly, that can be misleading sometimes. And as you said, we all are human beings under every other identity to be treated with dignity and privacy. So now I would request moving on to the next session, which is about the videos that we made out of the questions and discussions that we had with our community representatives. These are just the highlights from them, as we have very limited amount of time, but we will be uploading them with their consent on our social media accounts soon. So I would request Mr. Manish Gupta, member of the creative team, to kindly play the videos.
Being a community member, मतलब मैं एक अपनी कम्युनिटी को रिप्रेजेंट करते हुए और एक कम्युनिटी मेंबर होते हुए मेरा जो मैंने कम्युनिटी के साथ जो काम किया है और बीइंग अ कम्युनिटी जो मैंने सरवाइव भी किया खुद, तो मैं उस बारे में कुछ बताना चाहूँ कि ज़्यादातर देखो, चाहे वो ट्रांसजेंडर हो, चाहे वो गे हो, चाहे वो ट्रांस वुमन हो या ट्रांस मैन हो, हम लोग जो इस कम्युनिटी से जुड़े हुए हैं, कहीं ना कहीं बात आ जाती है उनके हेल्थ इश्यूज पर, और जब हेल्थ इश्यूज पे बात आती है तो STI, STD, HIV, TB, तो ये सब चीजें, ये अगर मैं एक NGO से हूँ, मेरा अपना खुद का एक NGO है, मैं एक NGO की डायरेक्टर हूँ, या मैं एक NGO की काउंसलर हूँ, या जो भी स्टाफ हूँ मैं, अगर मुझे दिल्ली गवर्नमेंट ने मुझे राशन दिया है कि मेरे NGO में आने वाले लोगों की मैं हेल्प करूँ, तो क्या मैं अपने NGO में आने वाले सिर्फ ट्रांसजेंडर को ही मैं राशन दूं, बाकी जो गे कोतियां हैं उन सबको मैं अलग कर दूं? मुद्दे जो है कहीं ना कहीं ये हम लोगों से जुड़े हुए रहते हैं। लेकिन ये चीज NGO में अभी मैंने देखा है इन 3-4 महीनों में, मेरे पास कई लोगों के फोन आए थे कि हमारे पास जॉब नहीं है, हमें राशन की दिक्कत हो रही है, क्या कोई ऐसी NGO है जो हमारी हेल्प करेगी, हमें कुछ पैसे दे दे या हमारे को राशन की हेल्प कर दे। तो मेरे कांटेक्ट में जितने थे, मैंने उन NGO के बारे में उनको जानकारी दी। बाद में उन्होंने कॉल बैक करके मुझे ये फीडबैक दिया कि वो NGO जो है वो सिर्फ ट्रांसजेंडर को ही दे रहे हैं, क्योंकि ट्रांसजेंडर नाचने गाने के लिए जाते थे, आजकल गली मोहल्लों में उनको घूमने को नहीं मिल रहा, उनकी रोजी रोटी बंद पड़ी है, तो इसीलिए उनको हमें देना पड़ रहा है। तो भाई बाकी लोग कहाँ जाएंगे, गे कोती लोग कहाँ जाएंगे? वो लोग भी तो तुम्हारी कम्युनिटी का हिस्सा है, उन लोगों को क्या मिलेगा? नहीं दे रही NGO उनको। और रही मेडिकल सपोर्ट तो कुछ भी नहीं मिल रहा। मैंने अपने कुछ सपने मैंने देखे हैं, उन सपनों को मैंने नोट करके रखा है डायरी में कि मुझे ये सपने सच करने हैं। क्या ये कोरोना की सिचुएशन में, कोरोना की वजह से, क्या ये मेरे सपने सच होंगे कभी या नहीं होंगे? ये डर मुझे रोज लगा रहता है। जॉब को लेकर के है कि बिना जॉब के अगर वो घर में बैठे हैं और उनको इस टाइम में पैसों की बहुत ज्यादा जरूरत है, राशन की बहुत ज्यादा जरूरत है, अगर वो उनकी जॉब चली गई है, उनकी नौकरी चली गई है, तो क्या कोई ऐसा ऑप्शन है जो घर बैठे वो कुछ ऐसा कर सकते हैं जिससे उनको कोई इनकम सोर्स का कोई जरिया बने? या फिर अगर जो NGOs हैं, वो NGOs क्या उनको किसी तरीके का कोई जिस तरीके से सेल्फ हेल्प ग्रुप होते हैं वो बनाते हैं एंड देन वो मार्केट में जाता है एंड फिर वो बिकता है तो वो पैसा उनको आके मिलता है, तो वो तो सेल्फ हेल्प ग्रुप हुआ। यहाँ पर हम कम्युनिटी को, जो इंडिपेंडेंट हैं, जो टैलेंटेड लोग हैं, उन लोगों को गवर्नमेंट या NGO जो है वो इस तरीके से सपोर्ट करे, ऐसी सिचुएशन में जहाँ उनको बाहर निकलना नहीं हो पा रहा, वो अपने घर में बैठकर कुछ ऐसा काम, कुछ ऐसी मेहनत करे जिससे उनको ये भी लगे कि हाँ वो काम कर भी रहे हैं, उससे आगे भी कई लोगों को फायदा हो रहा है और उनको भी वो फायदा मिल रहा है। अगर इस दौरान अगर उनको कोई दिक्कत, कोई परेशानी आती है तो वो कहाँ जाएं, किधर जाएं और किससे कांटेक्ट करें? क्योंकि हर कोई इस वक्त डरा बैठा है बाहर निकलने में। काउंसलिंग, मेडिसिन और न्यूट्रिशन उनको मिलना चाहिए क्योंकि वो तो बाहर निकल नहीं सकते। और इस वक्त सारे हॉस्पिटल्स में ये सर्विसेज तो अभी प्रोवाइड कोई कर नहीं रहा है क्योंकि सब कोरोना को लेके ही फोकस कर रहे हैं। तो जनरल प्रॉब्लम जो हो रही हैं, लोगों को जो परेशानियां हो रही हैं, तो इस सिचुएशन में तो वहां पर उनको कोई ट्रीटमेंट ही नहीं मिलेगा। तो ये होना चाहिए कि उनको घर बैठे ये सारी चीजें, सारी सुविधा उनको घर पे मिले।
कोई रिक्शा ऑटो करवा दिया, जैसे जान पहचान का कोई ऑटो वाला है, और वो हमें लेके आया, हमें रिसीव करके हमें वहाँ हॉस्पिटल ले गया। फिर हॉस्पिटल में फिर हमने है वो साथ में जैसे होते हैं आउटरीच, तो उन्होंने हेल्प की, साथ में गए, हमारे दवाइयाँ दिलवा दी, हमें ऐसे से हेल्प करवाई। बहुत सारे जो लोग हैं जिनको जैसे कि स्किल्स हैं जिनके पास, ठीक है, मैं तो हमेशा कहती थी स्किल अपने को डेवलपमेंट कीजिए, अपने जो स्किल्स हैं उससे आगे बढ़िए, क्योंकि एजुकेशन है नहीं तो हुनर तो होगा, और गॉड गिफ्टेड हुनर होता ही है। किसी को डांस का है, किसी को पेंटिंग का है, किसी को मेकअप है, ठीक है, किसी को हेयर ड्रेसर के लिए है, कोई हेयर कटर, हाँ ड्रेसर जो बाल वाल भी काटता है ना, तो बहुत सारे हैं, सबके अंदर हुनर है, तो अपने स्किल्स को ना डेवलप करना चाहिए और खुद अपने पे डिपेंड होकर अच्छे लेवल पे काम करना चाहिए। मैं तो यही चाहती हूँ कि ना अपने हुनर से भी इंसान आगे बढ़ सकता है। और फर्स्ट ऑफ ऑल मैं तो यही चाहती हूँ कि हमारी कम्युनिटी ना एजुकेशन की तरफ ज्यादा ध्यान दे, क्योंकि ना देखो जैसे जनरली लोग पढ़ाई करते हैं ना, वैसे हम भी पढ़ाई मतलब करें या हमारी कम्युनिटी करें नॉर्मली, उनको टॉर्चर ना सहना पड़े, है ना, जिससे उसको भेदभाव डिस्क्रिप्शन वो है ना, वो चीज नहीं होनी चाहिए कि एक लड़का एक लड़की और हाँ ये कौन है, तो इस तरीके से ना उनको वो भेदभाव करें। देखते हैं ना जैसे क्लासेस में बॉयज स्कूल है, ठीक है, उसमें एक ट्रांस बच्चा है, तो उसको एक बहुत अलग से व्यवहार वो करा जाता है, बिल्कुल एक कोने में कर दिया जाता है उसको, है सारे लड़के एक हो जाते हैं और ट्रांस अकेला रह जाता है। तो वो चीज ना हो, पार्टीशन ग्रुप ना बन जाए कि नहीं हम तो मेल हैं, ये हमारे ग्रुप में नहीं आ सकता, या ये मेल नहीं है। जॉब्स जो है ना, एक जनरली जॉब्स में जो वैकेंसी है ना, हमें हमें भी ऑप्शन मिलना चाहिए, ठीक है, उसमें कहीं कहीं ना बहुत सारी जो फॉर्म्स है उसमें अभी भी टीचर कॉलम नहीं आया है जिसमें वो भरना चाहते हैं लोग, है ना, बस खाली 2-3 गवर्नमेंट जो जॉब्स है उसमें दिखाया, जैसे रेलवे ने दिखाया खाली है, और एक जो है सिविल डिफेंस में डाला है, तो वो मुझे बहुत अच्छा लगा। सिविल डिफेंस में भी उन्होंने दी अपॉर्चुनिटी, लेकिन उस सिविल डिफेंस लेकिन फ्यूचर नहीं है, कभी भी बंद हो सकता है, निकाल सकते हैं, तो इस तरीके से ना हो ना, एक फ्यूचर भी बनना चाहिए, एक चांस का अगर वो भर्ती होती है तो उसका फ्यूचर भी एक सेट हो जाना चाहिए, है। तो इसमें क्या है, सिविल में ना ये था कि इसमें जब तक काम है तब तक ठीक है, उसके बाद हटा सकते हैं। सिविल डिफेंस में भी मैंने देखा था, और एक ही ट्रांस रखा और ट्रांस रखे नहीं, ये बहुत गलत बात लगी मुझे इनकी, ठीक है। आपने इतने तो मेल्स रखे पता नहीं कितने लाखों, उसमें फीमेल्स भी रखी लाखों, तो एक ही ट्रांस क्यों रखा इतने लाखों में, कम से कम 5-10 हजार भी तो ट्रांस तो रखते कम से कम। ये जो है देखो, हमें अपने नजदीकी एनजीओ से मिलती कुछ जानकारी, ठीक है, और फिर दूसरी बात है सोशल मीडिया, जिससे हम कनेक्टेड हैं। आजकल हर कोई आम इंसान कोई भी सोशल मीडिया से जुड़ा है, ठीक है, चाहे वो पढ़ा लिखा हो चाहे ना हो, एंड कहते हैं ना इंटरनेट वगैरह, उसमें सब कुछ आता है आजकल, है ना। तो सोशल मीडिया से हमें पता चल जाता है, दूसरा हमारे एनजीओ से हमें पता चल जाता है, तीसरा हमारा जो सर्कल है ट्रांस का, इसमें जिसमें अच्छे लोग भी हैं, हाई प्रोफाइल भी हैं ट्रांसजेंडर में, तो वो अपने लेवल से, तो हमारी आपस में ग्रुप्स बने होते हैं, तो उसमें कोई कुछ डाल देता है, कुछ इन्फॉर्मेशन डाल देता था, ऐसे पता चल जाती है सारे लोगों को।
Thank you, Mr. Manish. So the key highlights of the interview with the community representative with the transgender communities include that they had a certain ask to present to our speakers and also to all those who are going to watch this as a means of advocacy, where they wanted the civil society to make skill development opportunities available for them in addition to the health related services that they provide already. Education and vocational institutions should work to include transgenders, as education is the key to promoting transgender inclusive communities. They mentioned about after repealing of the section 377, there is a small increase in the availability of employment opportunities, but the intake of one transgender for every lakh of population is still very discriminatory. Transgenders need to have more representation alongside men and women, and as many transgenders are inclined to different forms of art, government and civil societies should promote art related skill development and employment opportunities. So thank you so much, Mr. Vishnu, for working on those videos and putting them together with the audios that we collected either through telephonic interview or through our Zoom calls. Moving on to the next session, I would like to call Purnima. Purnima is our team member, and she will take over the ceremony from now onwards. Purnima. Purnima, over to you.
Hi everyone, my name is Purnima, and I would now like to invite Mr. Uluch Madhyam. Mr. Uluch Madhyam is a technical advisor, author, and a creative writer. He has gained most of his over 16-year experience in health, social work, social and behavior change, communication within the non-governmental sector, with responsibilities in leading prevention and communication programs targeting diverse cadres of audience in various countries in Africa and Asia. He has been engaged as a health communication, community creator, and drama consultant, and as a prevention advisor and senior technical advisor on youth, by both international development organizations, universities, and the Ministries of Education and Health in Kenya. He is a published creative writer and a hobbyist farmer. He is very passionate about ensuring that useful innovations that promote health and quality of life are taken up and utilized by those most in need of them. He continues to seek innovative, sustainable, and economical solutions to social and health issues by designing easy to use interventions. The floor is yours, Mr. Madhyam.
Thank you very kindly, Purnima, for such a kind introduction. And I am particularly happy to be in this community of colleagues who are working to find ways in which we may be able to better support our marginalized communities and those who are vulnerable. I am absolutely thrilled to listen to the previous speakers and to watch the videos of some of the communities that I did work with in India some time back, and to also see that they are continuing to reflect about better ways in which they can achieve absolute good health. Now, having said that, I think I wanted to begin by saying that the COVID-19 situation has given us some critical points of reflection. And in my reflections going forward, I want to say that let us think about not only finding ways in which our marginalized and vulnerable communities should adapt, but also us as policymakers and implementers and designers should be able also to adapt and maybe be better servants of our marginalized communities. There are three things that I want to highlight initially that have been caused by this COVID-19 pandemic. Number one, we are now living in a scenario where individuals, marginalized communities, vulnerable communities, and even ourselves have started to rank our needs. The fact that folks are losing jobs, are losing opportunities, social networks are breaking, folks are beginning to rank their needs. And this may be significant to healthcare providers. For example, everybody now is looking for food. Everybody is thinking about their shelter. And those of our marginalized communities who have families are thinking about how do we sustain them. In that context, then you realize that our preventive and treating commodities, health issues are set on a back burner. And this is a big risk. The second one is that NGOs, and when I was listening to the video and reading the findings, I found the fact that NGOs are being asked now to think about being multidisciplinary rather than just being focused on health, and therefore we let other stuff out. Multidisciplinarism and multi-sectoralism. How do we work together with other sectors to now work in terms of pulling together so that we may be able to offer packages of services to our community? And thirdly, which I am glad some of our speakers may have referred to, is to what extent do we improve the self-efficacy of our marginalized and vulnerable communities? And I like those who talked about human rights approach. What languages are we using? How are we considering our colleagues? Are they, in quotes, and excuse me for saying this, are they a third gender? Or should we talk about gender? Now, once we decide to talk about gender, and that we've mobilized our marginalized communities along health, the issue then becomes, are we increasingly serving our populations to become dependent upon ourselves? Or in the course of serving our communities, we are giving them fish and teaching them how to fish? Excuse my symbolism if it's not appropriate in the context of vegan communities, but let's think about it in this particular form. So that when our marginalized communities feel that there are some services that they may be lacking because those services are provided only to a certain level of citizens who have an identification card, we should work in such a way that we are reminding our marginalized and vulnerable communities that they are part of this citizenry. And therefore, they may have the responsibility, and we facilitate them also to get those IDs. I wanted to highlight in my talk that during this pandemic, there are basically two things that happen, and we should probably look at COVID-19 in such a manner. COVID-19 brings about dangers or risks, let's talk about. And therefore, everyone is scared about the dangers of COVID-19. And when we were talking about the movements and the migrations of workers from, urban areas to their homes, there is a danger that they're talking about. I may not be able to pay my rent. I may be infected. I am vulnerable. And therefore, we move to another place where I may be able to have lesser, cost of life. So the first one is danger. I just wanted to put across in this webinar that if we concentrate on the dangers of COVID-19, we risk leading ourselves to situations of self-pity, and that these elements of self-pity may exacerbate our mental health issues. But COVID-19 also proffers us a different thing. It gives us opportunities. So there are dangers and there are opportunities. If we concentrate on looking at the opportunities provided, then we may be able to develop the self-efficacy of our communities. And so the summary probably of my reflections in this talk will be, to what extent do we balance our concentrations on the dangers of COVID-19 and the potential opportunities that COVID-19 provides, so that we have a balanced mental health going forward. And to do that, therefore, we must appreciate that there are some situations we are observing at the individual level that are dangerous and risky because of COVID-19. Our transgender, our men who have sex with men, our sex workers. There is increased anxiety and depression, and our colleagues have talked about lack of, economic access. Social and psychological problems. Our colleagues have talked about the ICTs that used to provide services now are closed. Healthcare providers may no longer be able to provide services as they used to do. There are disruptions on basic needs. And I think the world over, we are seeing people dealing with the issue of access to food, a very basic matter. So you can imagine the vulnerable communities, and once these basic needs are put out, then folks are having issues. Finally, there is anger, there is frustration, there is violence that's going on, there is further discrimination. But remember that our marginalized communities do live lives of discrimination, of anger, of stigma, even in normal circumstances. Now, this has been highlighted tenfold. So those folks who are talking of first, second, third gender are further pushing away our minorities. And therefore, we need to work in terms of that, ensure that our colleagues come to a balanced situation. So what are the potential solutions that I am seeking to suggest as we move forward? And I am looking at this from the point of view of the individual and sometimes also of the whole policy development area. Number one, how can we begin to reflect about home delivery of services to our marginalized and vulnerable communities? If we have sexual and reproductive health services and commodities that our vulnerable communities were receiving in the diocese, etc., can we begin to create networks of allowing and facilitating home delivery of contraceptives, of condoms, of PrEP, of HIV self-testing kits, so that we do reach out to where they are than waiting for them to come to where we are. Number two, we have been dependent a lot about working with the healthcare providers who provide us with competent screening and treatment options. Now, is it possible for us to begin to adopt self-care methods for health and well-being? Can we build the capacities of our transgender, of our MSM, of our sex workers to self-screen for HIV, for pregnancies, for STIs, so that we reduce A, the need for the healthcare provider, and B, therefore the time that may be needed in the interactions of the two. So self-care methods may be one way in which we will mitigate the problems of COVID-19. Thirdly, for our transgender who are on PrEP or on ARVs or on any other commodity issues, how do we begin to adapt multi-month drug dispensing opportunities? Rather than providing them 1 week or a monthly one, can we do 3 months? And then what are the potential issues or infrastructure that we need to put in place so that we mitigate that long period of time? Fourthly, virtual safe spaces. Because our transgender and their social links are being cut off because of COVID, can we utilize technology to create virtual communities so that our colleagues may be able to reach out to each other like we are doing right now, and therefore share in a confidential manner ways in which they can deal with their issues. The next two are in terms of food, and Punima talked about my hobbyist farming. But how are we able to adapt creative skills of agriculture, for example, multi-story gardening or vertical gardening, so that our transgender, our MSM, our vulnerable communities may begin growing their own food even when they don't have pieces of land? Can we have a sack, and out of that sack they grow their vegetables? Or on their walls outside, can they be facilitated to develop the skills to be able to grow a vertical garden, so that we are beginning to spread our disciplines as healthcare providers? And finally, let us work to facilitate our vulnerable communities to get government documents. It will be absolutely bad for us if our vulnerable communities and the stigma that they have and the discrimination they have further lack government services because they just did not access the government document like IDs. Let us mainstream the normal expected citizenry documentation into all our work. So thank you very much, and I welcome any reflections post this, and thank you for having me. Asanteni sana, shukria.
Thank you so much, Mr. Madhyan. It has been very insightful hearing you talk about COVID-19 and community participation and about the NGOs being asked to think about multidisciplinary and being multi-sectoral rather than just focus on health. Yeah, it has been very insightful and also about the solution. So now, moving forward, we would like to invite Ms. Francis, a professionally qualified social worker with over 30 years of experience in developmental work. uh, Ms. Francis has diversified exposure at the grassroots levels with the rural and tribal and marginalized communities such as sex workers, MSM, transgender, and drug users in India. She is the founder secretary of an organization known as We Care Social Service Society that was formed in 1994 in Tamil Nadu and has implemented various projects with funding from national and international organizations. The organization received the Best Innovative Project Award from South Asia Development Marketplace, organized by the World Bank in 2008. And the organization's intervention was one among the 5 documented as one of the best models among 26 projects awarded. Ms. Francis functions as an external member of internal complaints in Committee of POSH, Prevention of Sexual Harassment in Workplace, in over 20 industries in Tamil Nadu. She has also experience in managing projects at state and national levels with the reputed organizations such as PATH International and USAID funded AIDS prevention and control project. Thank you.
Hello, good evening, everybody. Ash, thank you very much for giving me this opportunity. Thank you, Madhyan, for providing a wonderful solutions that are more practical and feasible. It's so beautiful. I'm so happy to listen to all the key speakers, and I would like to speak more positive, handling how to handle the situation in a more positive manner. I start from my experience. I have a vulnerable health condition. I have 2 morbidities, hypertension and asthma. But still, I'm not sitting at home. I'm always traveling, moving around and supporting people, helping poor people, families, migrants, and so many people. So in that way, I'm not careless, but I'm taking all precautions. I'm taking utmost care to prevent infection to me. At the same time, I'm moving around and helping people. So that is a positive message that if for a healthy, positive outlook is most important for a mental well-being. So that is the first message. Keep yourself positive. Then it's very easy for you to handle the situation. But with my experience in moving with rural, tribal populations and urban poor, it's very diverse. There is different impact on different groups that are very diverse. When you take rural, there are different communities. Like we have tribal populations. In our area, we have this Irula tribes. They are known as snake catchers. And now they don't catch snake, but they work as casual laborers. And we have Dalits. Most of the Dalits work as agricultural laborers. They are landless agricultural laborers. We have small, medium, and marginal farmers, small traders and vendors, skilled and unskilled laborers. So each one, this COVID-19 has impacted differently to these groups. For example, tribal people, when you enter into their house, you will not find anything. It's only a shelter, a roof, and nothing will be there. Only few clothes will be there. So every day when they go for work, they earn some money and they eat. If there is no money, they will not complain, they will simply sit at home. So that is the condition. Dalits, the agricultural laborers, that is the same condition for them. Only thing is they may store some grains that they obtain from farming. Medium and marginal farmers, the major risk is because of this lockdown, they could not sell their produce. I found many farmers just leaving the produces in the farm. Like watermelon is a season during this time, and a lot of other water based vegetables. They were just simply thrown in the farm. And people, they were working very hard for 3 to 6 months and waiting for this harvest. They have nothing in their hand. Only they have to pay the debts and there is nothing to eat. So these are the situation of farmers. And small traders, especially the people who are street vendors, they could not do anything. They take money from a money lender, 1,000 rupees, they buy products, they go and sell it in the market, and they come back, they have money only for feeding the family and to buy next day's materials for selling. So this is their condition. When suddenly this entire lockdown is announced, it has completely shattered these families, these people. So they could survive for 1 week, maybe 10 days. Afterwards, it's a huge question mark. So this is when you come to urban slum, there are different type of slum dwellers and relocated labor force. Because of major projects in the metropolitan city, people who were living there were relocated to other places with a very without any facilities, without any basic facilities. They were simply dumped in some places. And they were struggling hard to find some better job. They were like surviving. Even that survival was at stake due to this COVID. And you all know about the plight of migrants because it was always in the media and all of us know about it. And the same problem with the slum dwellers. So, but when this problem was there, and we have already discussed about the problems of positive people and key populations. So what we did in our area, how it affected everything. The mental well-being was affected because of various factors. Social factors, the mobility was completely affected. People who went with their two-wheeler, they were taken by police and that was kept. Even now it's in the police station. Only now the people are struggling to get their two-wheelers. And they could not access any services. Even if they are sick, they could not go to the hospital. People who are getting regular medication for non-infectious diseases, they could not go and get any medicine. And livelihood is affected, that all we know. Some families, they have organized weddings, they could not conduct the wedding. And economical loss is more. So there is loss of business, the loss of crops, all these things. And for many people, spiritual well-being is affected because many people feel that only when they go to the church or temple, they feel good. So that is also a very big mental barrier for many people who believe that they could see the God when they go to church. So psychological factors, this all add up to the psychological factors. Anxiety, fear, frustration, helplessness, with so many. I could see a lot of suicides happening in and around our area. Even today I saw the suicide of a father and a child. So this is increasing day by day. If we don't address these things, it's going to be a catastrophe. So in this situation, what we have to do is to offer hope and support. People should feel happy that we are still survivors. We are living. When people are dying, when many people are dying on the road, dying due to corona, dying due to various other factors, we are still living. So make them to feel positive and think positive. When you always draw a small line, when there is a line, you draw a bigger line, then this line looks smaller. So that's how I was doing it with some of our people. Some of my friends, some of my known contacts, they were struggling a lot to cope up with this situation. So I just pulled them. You just come with me. Let's go there. Let's do some relief work there. When I took them to different places, when they saw the condition of other poor people, other sick people, they realized, oh, I'm a blessed person. Oh, I can handle it. So that kind of support they get, they think positive, they are able to feel that they could overcome this. That we have to offer to everyone. And then it's not NGOs, it's not government that came to support many people. It's really heartening to see that many individuals, many small groups, they came forward and try to help others. And this WhatsApp, it was so helpful for many people. There were so many WhatsApp groups, and every time this social media is really doing amazing things now. People are sharing their problems. People are sharing small videos of their agonies, and it is shared across the globe. And people have started to helping them, even without knowing their face, without knowing them. People are coming together and coming to help people. So in that way, we could move mountains. I was able to mobilize a lot of resources, and I was able to help many people because of this. Whenever we received, we are sitting here in Tamil Nadu. There was a WhatsApp video from the north, somewhere near Bhopal, and people were crying for help. We immediately contacted friends there, and we organized help, and we were willing to provide financial support, and they were able to organize help from there. So in this way, we were able to organize help to Gujarat, to many other places, Assam, and organizing help for the migrants who are stranded in other states and migrants who are stranded in our state. So this use of social media was amazing, and we were able to help many people. And it's a kind of a bond. It developed a friendship, a togetherness, giving hope that we are there to help you. So that gives lot of hope and comfort to many people. And a friend, Madiang, and even one of Abina was telling, people are seeking alternatives. When you are not able to earn money, then you are through sex work, you are running your vegetable shop. This is what we were advocating when we are working with key populations. Always have some alternatives. So even Madiang was saying, he was giving suggestions about alternatives. So we always have to think about alternatives. Only that will help us. At these type of crises are going to come very often because of the climatic conditions. So we have to be prepared. We have to keep ourselves very strong, and we have to be ready to face any challenges. So think of alternatives, and we can do more. We can do. When you think, you get lot of ideas. When you seek for help, you definitely get help. That is my main suggestion for everyone. And people who are depressed, I think we have to help a lot of people. Sometimes we receive message about very negative messages, like people are feeling depressed, that you could see from the message. Reach them immediately. Offer your help. Let them not kill themselves without trying any options. So that has to be stopped immediately, wherever possible, whenever possible. We have to help them to come out of it. And there are a lot of online supports. Helplines are available. Government has established a lot of helpline, counseling services, online counseling. People should make use of it. And even just by approaching the police personnel, people are getting help. Just approaching the government officials, the revenue departments. And in our state, I don't know about other states, in our state of Tamil Nadu, even if they don't have any ID proof, people are getting benefits from the government. Only thing they have to do is they have to approach the village administrative officer. So seek. When you seek for help, you will definitely get it. And people who are in ART, the ART centers approached us if we could go and deliver the ART drugs. We provided ART for the past 3 months. We are delivering ART drugs in our districts. So if the services are, if we could do better coordination with the government, with the health departments, with public health system and NGOs, and if we make little effort, we could organize the services for people. It is possible. So organizing support, people, especially our communities, they are always connected with WhatsApp or any other media. Try to find resources using these contacts. You can identify support. Don't go for bigger organizations. It may not come in time. But small initiatives, small organizations like Rotary Club, Lions Club, and you may know anybody personally. Through meetings, you would have approached somebody. They may know you personally, that you are a genuine person. When you go and ask, people will definitely help you. So that's how we organize our resources. Many people they came forward. If I say something, there is a need here. There is, when I request something for people, immediately they offer. So your credibility, with your credibility, identify people who trust you and then get help. And then you organize. This is the time we have to share our resources. Whatever resources you have, try to share it with others. That's what is happening everywhere now. People, it was so amazing to see in a slum area. I gave some provision to a family, and the girl, she called me and told me, "Ma'am, I shared it with 5 other people because they are also starving." So this you could see now. So this is a good time to understand people, to love each other and comfort each other and support each other. So only through this we will overcome this crisis situation. And when you look back, you will definitely feel happy and contented that we have done, we are united, we have done something, something fruitful to the society. This is what I wanted to share. Thank you.
Thank you so much, Ms. Francis, for sharing this valuable perspective on mental well-being of rural, urban, poor, and indigenous communities. Like it inspired me like how to be more positive, like keep yourself positive in this situation and how to handle the situation in a more positive way. So thank you so much. It has been very inspiring. And now, moving forward, we have like more videos from our interactions with the communities. I would request Mr. Manish Gupta to take over and play the videos, please.
तो वो गवर्नमेंट द्वारा खाना वाना बट रहे थे, उसमें खा रहे थे, कहीं घर से मंगा रहे, कहीं किसी से कर्ज ले रहे, ऐसे करके अपना जो भी है काम चलाया था। बाकी धीरे धीरे करके कोई यानी सारा ही हर किसी के पास जो रोज काम आने वाले हैं, जैसे आज कमाते हैं, महीना मिलता है, उनको सब कुछ करते हैं। अब उनके पास या तो सैलरी रुक गई या उनके पास जो भी था या किसी से कर्ज ले करके जैसे तैसे वो अपना काम चलाए हैं। बदलने का तो बहुत कुछ बदल सकते हैं, जैसे क्या बोलते हैं, अपने खुद का सुरक्षित रहना चाहिए। जैसे इन्फेक्शन है, बीमारी का डर है सब में ज़्यादातर अभी। जैसे कहीं तो किसी को हो रहा है, कुछ भी जा रहा है तो डर के कोई भी काम कर रहा है। जैसे मेरे पास भी, मैं कंपनी में बैठा हूँ तो मुझे डर लगता है, कोई जैसे आ गया बाहर से, मुझे नहीं पता उसको क्या है नहीं है। उनको वैसे जांच वाँच करना चाहिए ना, ये सब, तो किसी को इन्फेक्शन ना हो ये चेक करना चाहिए। ट्रांसपोर्ट नगर में एक तो कोई इतना जागरूक नहीं, यहाँ पे जैसे ये कोरोना की वजह से इसमें कोई जागरूक नहीं हो पा रहे हैं। किसी को बीमार भी पड़ रहा है तो कोई डर के मारे दिखा नहीं रहा है, डॉक्टर के पास नहीं जा रहा है। अब उनको क्या है, नॉर्मल सर्दी जुकाम भी हो रहा है तो डर के मारे जा नहीं रहा है कि पता नहीं क्या करेगा, पकड़ के ले जाएगा, ये थोड़ा बदलना चाहिए, उनको काउंसलिंग होना चाहिए कि इनको समझाओ कि ऐसा कुछ नहीं है, ये सब डर बैठा हुआ है। ये इस बीमारी के बारे में बताना चाहिए कि कैसे फैलता है, कैसे इससे बचना चाहिए, इसी के बारे में बताना चाहिए। बाकी सब कुछ तो नॉर्मल है, जैसे पहले था वैसे अब सब कुछ खुल रही है, धीरे धीरे करके खुल रही है। यहाँ पे एक तो पीने का पानी का बहुत बड़ी दिक्कत है, पीने का पानी नहीं आता है।
கடன்லாம் வாங்கியிருப்பீங்க, அதெல்லாம் எப்படி, என்ன பிரச்சனை, எப்படி அதெல்லாம் சமாளிச்சுக்கிறீங்க?
அது வந்து காசு வந்து வாங்குற இடத்துல வந்து யாரும் கேட்கல.
அப்படியா? நீங்கள் கடன் வாங்கியிருக்கீங்களா? ஆ, யாரும் வந்து கேட்கல. ஆனால் வட்டியோடு சேர்த்து அப்புறம் கொடுக்க வேண்டியிருக்கும். அது நிறையா கொடுக்க வேண்டியிருக்கும். கரெக்டா? ஆ,
10,000 20,000 கட்ட சொல்கிறாங்க.
10,000 20,000 கட்ட சொல்கிறாங்க. அப்பா. ஆ.
தெரிஞ்சு இதில் ஒரு நல்ல விஷயம் என்ன அப்படின்னா, அதுக்கு முன்னாடி திடீர் ஒரு ஜுரமா உடனே ஹாஸ்பிட்டல் ஓடி போகிறது, ஒரு ஏதாச்சும்மா என்ன எதுவாக இருந்தாலும் உடனே ஹாஸ்பிட்டலில் போய் நிற்பாங்க. இப்போ என்ன பண்ணுறாங்க அப்படின்னா, இல்லை வீட்டில் இருக்கிற மருந்து எடுத்துகிட்டு நம்ம அதுலேயே கொஞ்சம் பார்த்துக்கலாம். ஏன்னா ஹாஸ்பிட்டல் நம்பியே தான் இருந்தாங்க. இந்த கொரோனாவுக்கு பயந்துட்டு இப்போது வீட்டு வைத்தியம் பண்ணி அவங்க சரி பண்ணிக்கிறாங்க. நான் அதுதான் கேட்பேன். அதுக்கு முன்னாடிலாம் எதுக்கு ஒரு வயிறு வலினா உடனே ஹாஸ்பிட்டல் போகிறது, 1000 ரூபாய் செலவு பண்ணுறது, ஊசி போட்டு வருது. இப்போ எப்படி செலவாச்சுன்னா, இப்போ அதை விட பெருசு அங்கே இருக்குல்ல, அங்கே போனால் கொரோனா வந்துடும் எங்களுக்கு பயம். அது மாதிரி மெயினுக்கு மட்டும்தான் அங்கே போகிறாங்க. ஒரு ஆக்சிடெண்ட்டு, அதோட அந்த பிரசவம் ஆகிறது, அதுக்கு மட்டும்தான் அங்கே போகிறாங்க. இல்லை மேம், அவங்களுக்கு எப்பவும் போல தான் இருக்குது. ஏன்னா இப்போ ஏதாவது எங்கள் மூத்தார் அவங்க மருமகளுக்கு டெலிவரி ஆகியிருக்கு. அதாவது ஹாஸ்பிட்டலில் அந்த கொரோனா வார்டை தனியாக அவங்க செப்பரேட் பண்ணிடுறாங்க. அந்த பக்கம் யாருமே இப்போ வேன் கூட பார்த்திங்கன்னா அந்த கொரோனா பேஷண்ட்டை கூட்டிகிட்டு போகிறதுக்கெலாம் தனி பக்கம், இவங்களுக்கு தனியாக செப்பரேட் பண்ணி வச்சுருக்காங்க. இங்கே இருக்கிறவங்க யாரும் அங்கே போகக்கூடாது. அடிக்கடி அங்கே அந்த சுத்தம் பண்ணுறது அதெல்லாம் நல்லா பண்ணுறாங்க. அவங்களும் எந்த பிரச்சனையும் இல்லாமல் டெலிவரிக்கு முன்னாடி போய் சேர்ந்துட்டு, இத்தனைக்கும் சிசேரியன் தான் அவங்களுக்கு, அதை பார்த்துட்டு நல்ல விதமாக வீட்டுக்கும் கூட்டிகிட்டு வந்துட்டாங்க.
வருமானம் இல்லாமல் இது மாதிரி இருக்கிறதுக்கு இப்போ என்ன பண்ணலாம், எப்படி பண்ணுனா எல்லாருக்கும் வசதியாக இருக்கும்? ஏன்னா இன்னும் ஒரு மாதம் இன்க்ரீஸ் ஆகுது லாக்டவுன்.
அது கவர்மெண்ட்டு மட்டும்தான் பண்ண முடியும். ஏன்னா இப்போ ஒரு வாலண்டியர்ஸும் சரி, ஒரு என்ஜிஓவும் சரி, அவங்களால 1 மாதம் பண்ண முடியும், 2 மாதம் பண்ண முடியும். சரி, நம்ம ஒரு 3 மாதம், இவங்க லாக்டவுன் போட்டு 3-4 மாதத்துக்கு மேலே ஆச்சு. ஆனால் அந்த ஒரு 1000 ரூபாய் வச்சு இப்போ இருக்கிற விலைவாசியில் அவங்களால எப்படி சமாளிக்க முடியும்? எனக்கு தெரிஞ்ச மினிமம் ஒரு 5,000 இல்லைனா ஒரு 3,000ஆவது ஒரு மந்த்துக்கு கொடுக்கலாம். அவங்க சமாளிச்சிக்கலாம், ஓரளவுக்கு பிரச்சனை இல்லாமல் இருக்கலாம்.
Trisha,
Yes,
I
sir.
think Ashok was saying something, please. Thank you.
Yes. Dr. Ashok, I think you're on mute.
Okay, I'm unmuted. Can you hear me now?
Yeah.
No one can mute you, Ashok. No one can mute you. Not even yourself.
Thank you, Kalpana.
Let me laugh on that.
My name is Ashok Rao Kavi, and I represent an organization called the Mumbai Teenagers. Teenagers is actually a takeoff on teenagers, but we are senior citizens about the age of 55. And we are mostly gay, which means homosexual or bisexual men who are not married, possibly partnered, but at the moment living alone. And I looked at the old age population in India, and you'll be surprised to know that we are nearly 2.8 crores. Now, I want to tell you the effect of Corona, the lockdown that has happened. You'll observe that there is an enormous amount of mental pressure on teenagers because 50% of the deaths are among teenagers. of the corona, the COVID patients. And not only that, but if you, I read in yesterday's Times of India that many of the families of teenagers openly say that, you know, don't spend too much time, don't put him on ventilator, which means if he wants to go, let him go. It's called the triage theory, where they think of letting go of people who are not of much use to society. And older people in this country are not well looked up to. Now, as a teenagers, I am seeing the different coping strategies of such a vast population who has been useful to this country and now seem not to be useful. And I am pretty upset about it that nobody's looking at our issues. So we, in teenagers, we have got simple methods of support system. It's not just money. For the first time in teenagers, and I have realized that the cost of being a human being is a very difficult thing in today's India. It's not the money you have. There are people who have lots of money and who are all alone at home. Nobody cares for them. At the same time, there are poorer men who are well networked into the communities around them and yet are alone and need help. So over the last now 3 months, I have been alone. I can't get out. But it's very interesting how my society, my cooperative housing society, I live in a journalist colony, is looking after me. One family sends chapatis, another family sees to it that somebody comes and gives me the milk in the morning. There is facilities where vegetable trucks and fruit trucks are asked to come into the society compound. So people like us who are seniors can go and buy what are necessities and not go out and make ourselves vulnerable to infection, you know. So a lot of things are happening, but at the same time, we have not been quiet. For example, we have set up what are called buddy system to help people who are alone, possibly go to the doctor with him, possibly go for grocery shopping with him, go to the ATM just to withdraw cash. And these sort of support systems are making us realize, and people are around us realize that there is a old age population that they have not bothered to look at. See, the teenagers. I know at the moment that we are only in Bombay, but we already have inquiries from other cities. We are 3 years old, and we have had fabulous meetings like on mental health, on financial management, how we have done a video about teenagers in Bombay City, how we spend our time. We have a sort of system by which we call each other every Saturday, just to keep in touch. How are you? What are you doing? What have you had for lunch? Should I send something over with my, say, neighbor to you? And it's very interesting that we are finding that although we were invisibilized, and this civilization is supposed to treasure older people, it values older people, senior people, but to modern India seems to have forgotten us. So, you know, and I see this way across. For example, I'm in touch with third gender, the transgender older people who seem to be left alone because the younger people have already fled to their towns from where they come, the native, places. And the older hijras have reached out to us and said, what can you give me? I said, do you need food? They said, no, I just want you to talk to me. It's very interesting. The type of support system that have been built up during COVID have to last us beyond that. It is showing that the value of human beings is a great thing, and the cost of them has to be realized through our relationship with each other. With that, thank you very much.
Thank you, Mr. Ashok. I would request if Mr. Sundar would like to say something, as the room is now open for discussion and questions if anybody wants to ask anything, and Ms. Sushina as well.
I'll wait a bit, let people start asking their questions, and I can come back in later. I think there might be people wanting to actually ask questions or make comments. Thank you.
Thank you, Mr. Sundar. I think Abina wants to say something. Miss Abina?
Yes, thank you. I think everybody has talked about at length about how the COVID has impacted high-risk communities. The one of the things that I just want to talk about it is that it is not affected everybody similarly. What we need to understand, and while there are some generalized issues which are affected to the high-risk communities, specifically around big things about migration, which has impacted in access to the health services, and at the same time, also specifically around reaching to their near and dear ones. Because the fact remains is that when you talk about the communities like transgender community, or for that sake, a lot of MSM community also, and drug users community also, they are not staying with their families. Sex worker community, they are not staying with their family, they are staying away. Or at that point of time, if they are visiting, so like for example, there were a bunch of transgenders who were stuck in Delhi, who originally belonged to West Bengal. They came here for a ceremony called as Badai Toli, which happens during the Holi period, Holi festival, which was in March, and they were stuck here. They couldn't go back, and then they were subject to the exploitation from the community itself. Even in CSO community, there's a lot of community who's exploitative to the other people, just because they are on the critical positions and they can bully other people on social platforms, and they do it on various aspects like that also. I think I also want to add a specific thing about not only about the migration, but I would also like to add on certain things specifically around how the restrictions for the because of the lockdown, especially sealing the borders of the states, has impacted various communities like people who inject drugs. The cost of drugs increased by 600%, which was a huge amount of money. There were a lot of IDUs who were arrested by police. We don't have any data in this regard. A specific kind of medications which help them as an antidote, which was not available now. So, and there are a lot of communities who really worked around with that. Even OST and other facilities which were important for them were not being able to provide. With women in sex work also, the exploitations on the virtual spaces has increased. Not only physical gender-based violence, but also exploitations around these women who were subject to or who were kept with their family members. There was a lot of women became prey to the exploitation by their regular partners, and also for by their partners, because they were not earning sufficient amount of money. There were a lot of women who were not explicitly calling themselves as a women in sex work or sex worker, but they were working in parlors, they were working in spas, where they used to also do sex work, especially in states like Delhi. And lockdown has had a huge amount of impact, and this is not just the impact of a lockdown period, but I just want to also highlight that post lockdown is also going to be traumatizing, because the fact remains is, even you are into unlike situation, even if there are certain places where in the state there are unlocked situations which are happening, the business will be not usual for the high risk groups. The other day I was traveling to my office, and on Nehru Place in Delhi, there was one young trans woman, like 20 years of age. She was begging. I see her every day without wearing mask. And I asked her, that is, beta, aap mask kyun nahi pehante? Why are you not wearing mask? You see everybody is talking wearing mask. I am wearing mask. Community is wearing. Why are you not wearing mask? And she returned to me and she said, that is, what do I do? Do I die because of corona, or do I die because of hunger? Because right now even my guru is not willing to take care of me. And these are the acute problems that community is immensely facing when it comes to in the COVID-19 situations. The other thing is that access to the social schemes which are available. I mean, we managed to work around with NISD and managed to provide some amount of support to the transgender, where they try to transfer 1,500 rupees to the needy transgenders. But a lot of transgenders could not manage to avail those services because they did not have Aadhaar card and PAN card. They did not had enough amount of money. The frontline workers, especially the doctors, also along with the doctors, I just feel that is, even the outreach workers who are actually providing services to the community of ARV medications and all those kind of, lot of them are quarantined. The situations were so worse, and because of the binaries of the world, we did not had enough quarantine center for transgender people. And within the high risk communities, at least I heard that the first community incidences which was reported was from the transgender community, where a trans woman from the Hijra community died because of COVID-19 in just 3 days. And the community was also not involved into her death ceremony because so the huge amount of community mourn for that. But there has been a lot of positive changes also within this particular time period when it comes to the community people. um, I mean, the communities have gathered together. A lot of senior members of the Hijra community, MSM community, they offered a lot of support to the other community members with the help of ration, with the help of money, with the help of emotional and social support. We have also seen huge amount of issues around suicidal tendency. The other day, one of a trans woman who's openly living as an HIV put up a article, put up a note on the Facebook saying that this is my last day and I'm going to die tomorrow. And it was so pathetic. Everybody tried to help her as much as possible in that case. And she was saying is that I feel lonely. I don't have anybody to talk to. My birth family is not been friendly with me. They are not talking to me. I've been put into a situation for a lockdown period where I've not been able to cope up with the frustrations that I have with my love life, with my professional life or my social life, and I'm not been able to balance all these related aspects. I was bitten by the dog myself, and I have to take a rabies injections, and the entire lane where I would try to take the injections, none of the private doctor or anybody was willing to provide those kind of basic necessity health services to me by just putting a rabies infection. In fact, I went to a public hospital and to take the injections, and I was asked to sit outside, to the hospital, where they tried to give me. I was not even allowed to enter into a main space where they could diagnose or they could ask me certain additional questions and all those kind of things. So general health problem has been also immensely affected for the key community when it comes to the other related aspect. So I think what we need to understand over here is that the COVID has a huge amount of impact on various communities, and I think a lot of civil society members like Ashok and other people also are doing their bit of raising those voices, talking about the critical issues that are affecting. Like recently, there has been a discussions around some research which is affected to the sex worker, where they are saying that is COVID-19 is rapidly spreading because of the sex work, and there's a civil society group caucus which is actively working towards that on policy document and other related aspects. So there has been a lot of work which is happening for the community only, but these efforts are not synced enough. Everybody is doing the way they could be doing for the COVID-19 support. The other thing I just want to highlight about it is that we as high risk group and marginalized community have been skipped from the government radar. Pradhan Mantri Garib Yojana, which is supposed to be providing, in every state, supposed to be providing services to the marginalized people. We are not been able to be subject to that, and we are not been able to get even required support. Because there are a lot of HRGs and high risk groups which have been affected and don't have enough documentation to actually apply for these services. They don't know where to apply this. How do you avail those services within these areas? So I think those are the larger problem I want to talk about when it comes to COVID-19. This was everybody was talking elaborately about it, but I thought I just highlight about that. Is that right now our struggles are with food and shelter, but beyond that also there are other struggles are about keeping our mental health stable and being positive and optimistic about the situation. Thank you.
Thank you, Ms. Abina. So actually, we have spelled over the time like a lot. So I would request Mr. Sundar to please, if he wants to say something, we can manage to discuss for next 5 to 7 minutes. If you can say something.
Okay, I'll not take all the time. I don't have much to say. Basically, it was good to hear people talk, and it's always good to understand what's going on and assimilated in some ways that it makes sense, because a lot of what we continuously hear on the television, or we hear from the social media, or participating in prospective meetings like this, one definitely is left with a certain amount of confusion, because it's very early days to say that we have absolute clarity. If somebody says that much of what's happening is taken care of, I think they're trying to tell a different story, and that has only story value. It doesn't have a real value. So therefore, I think first and foremost, I need to thank all the panelists and the perspectives that you brought in this afternoon. And my take-home messages are just a few, given the fact that uh, each of you had been given only 10 to 15 minutes. And I would say, first and foremost, um, it's going to be a tireless job, and it's going to be a hard fight. So I would say to each of the panelists who are fighting the fight, make sure that you have preserved energies, conserved energies, because in the long run, I think you'll grow with understanding, and therefore your contributions will be significant. When I hear Ashok and the way he talks about having gone into a zone of aging, uh, I don't see a older man. He's a young guy still, because he is
Thank you.
really making sense out of what he's saying. So good, Ashok. There is no question of Alzheimer's around you. Uh, Diabetes might be a problem for you, but then that's handleable. But one request is that, don't keep drinking too many beverages within a short time. So that should take care of you better. But I think the more important point is that um, disenfranchised people, and during these difficult times, are going to continue to face the biggest brunt and the largest of challenge.
Beautiful.
And it takes me back to the time in 80s and 90s, and Ashok would recollect that very well, that we all got into the battleground thinking that we are in it for the short time. But then 35 years ran away from the time we detected HIV at Madras Medical College, where I was an assistant professor at that time. So I think in COVID also we need to plan for the long haul. Though the illness that the virus produces is only for a short period of time, maybe maximum of 3 weeks, the debility it might leave could be much more. And it also is questioning a lot of social conditions in which people in India are living. So we are in it for the long haul, just like how in HIV the battle is still on. It is not as if we have won the victories. Second is that I think over the period of time, we did realize in HIV, people have to make sure that the relevant and important voices are brought to the forefront in order for people to know and learn. Because I was shocked to understand that our government, with a very measly sum of $13 million available from Global Fund, applied for personal protective equipment for people in the front lines. Bull garbage shit. When World Bank has given $1 billion for the health sector to be upgraded. Now, the voices have been muted that we didn't even have a whistleblower who could actually reach out to the Global Fund and say, you fools, you're giving money to a country where that money is not required. But 30 years ago, the guts it took to a lot of people, and I'm remembering people who have died even now, to walk up to authorities and confront them on their face. Today, I think that guts is lacking because we don't have the people who have the real hardship go to the powers and call the bluff. So my second message is, we need to make sure that opportunities and spaces are given to the people who are actually bearing the brunt of what's going on with COVID and the confusion. The third, I think, which I think is my take home from this conversation, is we need to continue to keep hammering home to ourselves our relative roles and responsibilities. I really thank all of you because I would have probably spent this afternoon sleeping, which has become my compulsive practice these days, but to keep me up and to be engaged, and particularly thank the facilitators Purnima and Drishya and Ash and his colleagues for organizing this, and as usual pulling me out of the woodwork and managing to make sure I remember I'm not fossilized, but I'm still alive. Thank you so much indeed.
Thank you so much, Mr. Sundar. Now I think I would like to hand it over to Dr. Ash. I'm sure he wants to say something, and we have already crossed like a lot of time limit, but still, I mean, we can have a few minutes for all of us. Over to you, Dr. Ash.
Please, Ashok, you were saying something.
I
Thank
said
you.
you're smiling, so you have something nice to say, I hope.
Well, I was going to say a very big thank you, really. This is, like I said, to me, a major family reunion, but one where really I think hearts are connected, minds are connected, and souls are connected. And I think, we've heard so many important messages. I'm not going to even attempt to sum them up right now, but I know the one thing we've taken away is that we do need to come together, and we need to be embracing in our approach. And I just want to say that this is definitely part of a process, and I'm really grateful for this opportunity, for this time that we've had together, and for the incredible insights we've had a chance to not only listen on, but ponder and hopefully process. And with that, I wanted to say that, we do envisage this as one among many such interactions, and I'm hoping that we can not only start to dwell on the points that we've had a chance to listen in on, the important voices we've been able to bring together here, for which we're so grateful, but also begin to act on this and do it together. And I think that's been one very big underscored message here, that we do need to come together, and we do need to do this collectively. Together we will go far. And I just wanted to say that as we continue with our discussions with the community, as we start to weave in the community's perspective in everything that we attempt to do over the course of the next weeks, months, and hopefully many years to come, we definitely hope to continue holding hands and to do it together. So I'm not only hoping for collective conversations, but a lot of one-on-ones as well, to be able to seek your thoughts, your insights, and your wisdom and knowledge as we take this forward. And I want to thank you all very, very much for being here together with us. There will be follow-up. This is by no means intended as a one-off, neither as a panacea. But I just want to say thank you very, very much for being here together, and to the entire CHP family for a lot of work behind the scenes, behind today and before 2 o'clock today, in the communication and conversations with the community. And in that, I also want to thank everybody from the community who's very much a part of this family. So Thank you so much. And I know Ashok, you wanted to say something, so please
No,
do know.
no,
Okay.
I've spoken enough. Thank you very much.
And he's
Thank
had
you
his
so much
lunch
for
in
being here.
front of us, so I was so hungry.
It's not lunch; it's a brunch. I didn't eat this morning.
Okay, okay.
Okay. No,
That's
but
the
it's so
secret
good.
of
It's
your
so good.
figure.
And thank you for being here, and yeah, and for joining us, for letting us join you for brunch today. Thank you. It's been absolutely invaluable. And
It's
Sundar,
actually
I know
wonderful.
Sushil.
I wanted to use this opportunity to say it's wonderful to see Kalpana up here, my old girlfriend, and then my last girlfriend is Sarita is also here. So it's good.
Ashok, I told
This is
Sarita that you
intended
are
as
the
a
love of my
reunion.
life.
Yeah,
I
we
told her.
intended this as a reunion for your girlfriends to get together with you.
Lucky girls.
Ashok in double role. He doesn't know that the other phone is on.
That's a handsome photo anyways.
Yes, extremely.
Yeah, it is. It is. Thank you.
Bye-bye.
And thank you so much to each one of you. Thank you, Sundar. I know Sushina had to leave, but we'll keep the conversations coming. And thank you once again for your wisdom and insight, and for all the advice. I think we have a lot to work with already. Thank you.
And thank you, Sundar, first of all. Last, thank you, Sundar, for saying that this is going to be a long haul.
It
Because
is.
a lot of people out there, who break all the laws, think that by September everything will be all right. And we are going to see a series of spikes. All the big cities are in trouble. I get messages from every big city that they don't know what to do. There are no hospital beds, nothing. I get messages from big cities that the older people are now being abused because they're alone at home. They don't know this, and everybody's there at home, and nobody knows what to do with them. So all these things put together is going to transform human relationships. One, and secondly, we don't know where we are going because the future is very dark. Economies are collapsing. All sorts of things are happening. How do we stick together and at least retain our humanness? That's all I want to end with. Thank you, Sundar, for being there.
Yeah. Thank you. Thank you very much.
Thanks.
Really.
Bye-bye. Thanks.
Yeah.
Thank you to all the speakers for joining us today, and all the community representatives who are there in the meeting, as well as have joined us through via Facebook Live. I would like to thank my team members, Komal, Nitya, Philo, Manish, Purnima, and all those who were working with us who are not part of the meeting right now, for putting all this together. I would like to thank all the community representatives for sharing the insights with us. Before we end, we have one more video from our community, which is yet to be played. So I would request Manish Gupta to please play the video. While he is arranging to display the video, I would also like to mention that what was the main objective of conducting this webinar and going live was to create enough documentation which can be converted into videos and can be disseminated to the communities, to all the NGOs that we are working with, and further with other NGOs who are in the network, so that they can have a look at what information our speakers shared with us today. Also, we will be putting this document into a report format, and we'll share it with all the speakers and whoever. We'll try to make it language specific. We'll try to do the translation in Hindi as well as other languages, as we have people from indigenous communities as well. So thank you so much, everyone. And Vishnu sir, can you please, Mr. Manish?
सिचुएशन ये हो गई कि एक दूसरे के कनेक्टिविटी टच की खत्म हो गई, क्योंकि हम लोग फोन से कनेक्ट हो रहे हैं, एक दूसरे से मीटिंग्स में कनेक्ट हो रहे हैं, तो लोगों की जो मेडिसिन होती थी, जो ट्रीटमेंट्स होते थे, वो उनके रुक गए, क्योंकि जो लोग हैं जो HIV पॉजिटिव है, उनको मेडिसिन नहीं मिल पा रही, क्योंकि हॉस्पिटल्स में एक्चुअली कोई किसी को देख ही नहीं रहा है। तो ये सबसे बड़ा दिक्कत, तो उनकी हेल्थ इशू आ गया। दूसरा, उनको फाइनेंशियली दिक्कत होने लग गई, क्योंकि सबके काम धंधे तो बंद हो गए। जो कम्युनिटी होती है वो दूसरे मतलब जो उनका इनकम ऑफ सोर्स है, कहीं रेड लाइट्स मांगते हैं, कहीं सेक्स वर्क में इन्वॉल्व होते हैं, तो उनका वो वाला बिजनेस भी गया। ऊपर से जो उनके साथ एनजीओ खड़ी हुई है जो उनको सपोर्ट करती थी, अब एनजीओ ने भी पीछे एक स्टेप ले लिया। क्यों? क्योंकि किसी के टच में नहीं आना। जब कोई किसी के टच में नहीं आएगा तो उनको सर्विसेज कैसे प्रोवाइड होगी? जो उनकी बेसिक रेगुलर मेडिकल चेकअप्स होते थे वो भी बंद हो गए, उनकी एचआईवी की टेस्टिंग बंद हो गई, उनको जो बेसिक फैसिलिटीज मिलती थी वो बंद हो गई। तो इससे तो जो कम्युनिटी थी वो तो पहले ही गिरी हुई थी, अब वो ऐसे गड्ढे में गिर गई कि अब उसको तो उठाना एकदम से बहुत मुश्किल है। और अगर अभी भी एनजीओ ओपन हो चुकी है तो अभी भी हम लोग, मैं अभी रिसेंटली बताऊं, मैं जिस एनजीओ से रिलेटेड हूँ, तो हम लोग अभी अपने एचआरजीज को आने नहीं दे रहे हैं, क्योंकि हमारे पास कोई ऐसी फैसिलिटीज तो है नहीं कि हम किसी का कोरोना वायरस कोविड-19 का टेस्ट करके करेंगे तो हम उसको आने देंगे। वो तो एक दूसरा प्रोसीजर है, वो तो एक लाइन ही दूसरी है, उसमें तो हम जा ही नहीं सकते। तो लोगों का आना बंद हो गया, लोगों से कनेक्टिविटी टूट रही है, तो अब क्या पता लोग कैसे सर्वाइव कर रहे हैं। ये बहुत ज्यादा डिफिकल्ट सिचुएशन होती जा रही है आज के सिनेरियो में। और जिन लोगों की मेडिसिन चल रही है, एआरटी चल रही है, जिनकी एचआईवी पॉजिटिव है, उन लोगों को हॉस्पिटल में नहीं जाने दे रहे। अगर खुदा ना खास्ता उनको कुछ हो जाए तो उसका जिम्मेवार कौन होगा? तो कम्युनिटी तो, जो गवर्नमेंट्स है वो दूसरे लोगों को राशन दे रही है, ये प्रोवाइड करा रही है, वो करवा रही है, तो बेचारी जो कम्युनिटी है वो तो वहीं स्टॉप हो गई ना, वो तो एक ब्रेक इवन पॉइंट पे आके रुक गई। उनका क्या होगा? जो यंग जनरेशन है उनके साथ हम कनेक्टिविटी रख लेंगे, क्योंकि वो हमें इजीली, हम उनको आइडेंटिफाई कर लेंगे, वो हमारे टच में जैसे ना तैसे आ ही जाएंगे जुड़कर, और वो है भी। लेकिन जो हमारी दूसरी जनरेशन है, जो प्रीवियस जनरेशन है, उसके साथ हम कनेक्टिविटी कैसे करेंगे? जो हमारी लोकल एनजीओज है उन्होंने डेली फूड बांटा, क्योंकि कुछ ना कुछ करके एनजीओज को तो करना ही था अपने कम्युनिटी के लिए, तो उन्होंने कांटेक्ट करा और वहां पे उनको डेली फूड प्रोवाइड होता था। फूड के बाद 1 महीने तक तो फूड चला, उसके बाद जो हमने उनको ड्राई ग्रोसरी दी, उसके अंदर हमने किट्स बनाकर दी थी जो दिल्ली गवर्नमेंट की तरफ से भी आई थी, और उसके अंदर उनको बेसिक मतलब 60 to 80 पीपल हमने एक दिन में, मैंने खुद जाके फिजिकली जहांगीरपुरी में के ब्लॉक में मिला था, हमने प्रोवाइड करवाया है। तो फिर हमने ये करा, क्योंकि फाइनेंशियली किसी की हेल्प करना, तो अभी तो लोग सेक्स वर्क नहीं जा रहे हैं क्योंकि इतना पैसा नहीं कमा पाएंगे वो, क्योंकि लोग वैसे ही डरे हुए हैं। तो ये वाली तो उनका काम बंद ही हो चुका है अभी थोड़े टाइम के लिए। तो टोली बधाई भी नहीं हो रही है। तो चैलेंजेस यही आ रहे हैं, वो इसलिए निराश भी है क्योंकि जब पैसा ही नहीं होगा तो लोग फिर एक उम्मीद छोड़ देते हैं। जब पैसा ही नहीं होगा तो आप घर परिवार कैसे चलाओगे अपना? ये काफी दिक्कत चैलेंजेस होती है। ऊपर से गवर्नमेंट स्टार्टिंग में हेल्प करी और अब एकदम से बंद कर देना और फिर एकदम से स्टार्ट कर देना, क्या उनकी प्लानिंग प्लॉटिंग है? और वो भी उन्होंने इसलिए हेल्प करी क्योंकि हम लोगों ने उनको प्रेशराइज किया था। जो हमारे लोकल विधायक और एमएलएस होते हैं, हमने उनको प्रेशराइज किया था, तो तब जाके उन्होंने ये आउटकम लिया कि हाँ, इस कम्युनिटी के लिए भी कुछ करना है। तब जाके उन्होंने कोई स्टेप लिया, वरना कौन पूछ रहा था? कोई नहीं पूछ रहा था। पहले ही कम्युनिटी की मांग थी कि हमें भी मतलब कुछ जॉब्स में कुछ रिजर्व सीट्स मिले। अगर कम्युनिटी के पास पहले ही अगर जॉब्स और रिजर्व सीट्स होगी, मतलब जो लोग पढ़े लिखे हैं, जो इस फील्ड में पढ़े लिखे होने के बावजूद भी वो सेक्स वर्क में इन्वॉल्व है, तो ये उनके लिए बहुत बड़ा एक दुर्भाग्य है, क्योंकि इतना पढ़ा लिखे होने के बाद उनको जॉब्स प्रोवाइड नहीं हो रही। तो गवर्नमेंट ने अगर उनको पहले ही जॉब्स प्रोवाइड करी होती तो आज वो सेटल होते, तो आज अगर वो फिर किसी पे डिपेंड भी नहीं होते। क्यों? क्योंकि ऐसे नहीं तो वैसे मतलब सैलरी तो आ ही रही थी, चाहे थोड़ी आए चाहे कम आए। तो गवर्नमेंट को ये स्टेप्स पहले लेने चाहिए, क्योंकि ये कम्युनिटी ऐसे है, ये तो एक बैकवर्ड जिसको कहते हैं और बैकवर्ड में घुस गई जाके, क्योंकि इसको तो वैसे ही उठी थी और अब वैसे डाउन हो गई। तो गवर्नमेंट को ये सोचना चाहिए कि सिर्फ कोविड की वजह से नहीं, अगर आप उनको पहले उनके बेसिक फैसिलिटीज, बेसिक हक दें उनके, तो ये कम्युनिटी बहुत अच्छे अपने आप को प्रूव कर सकती है। सेल्फ स्टैंड लेने लग गया है, लोगों को पता चल चुका है कि भाई अपने आप ही करना पड़ेगा तो करना पड़ेगा। लोग आजकल तो किसी रिश्तेदार से भी नहीं मिल रहे, तो सब अपना एक सेल्फ एजेंडा लेके ये चल रहा है कि भाई अपने पैरों पे ही स्टैंड होना पड़ेगा कुछ अगर करना है तो। क्योंकि अगर मैं कहूँ कि कम्युनिटी है, कि कम्युनिटी से सेक्स वर्कर कर रही है, तो कम्युनिटी को पता है कि अगर आज मैंने एजुकेशन ली होती तो मैं दूसरी फील्ड में होता, तो मेरा सोर्स ऑफ इनकम मेंटेन रहता। उतना नहीं रहता, थोड़ा बहुत तो रहता ना। तो ये पॉजिटिव चीज है कि लोगों के अंदर एक जागरूकता आ चुकी है कि अपना सेल्फ स्टैंड लेना है। और नेगेटिव ये आई है कि जो कम्युनिटी है वो पैसा उड़ाने में विश्वास करती थी। उनको अगर उन्होंने ये चीज सोची होती कि सेविंग करके चलते, तो जो लोगों के माइंड में एक दिक्कत आई है वो पैसे को लेकर आ रही है। इकोनॉमिकली चाहे आप नॉर्मल लोगों की भी बात करोगे, जॉब्स जा रही है, कम्युनिटी सफर कर रही है, लोग भी सफर कर रहे हैं। जब जॉब्स नहीं रहेगी, पैसा नहीं रहेगा, तो लोगों का माइंड तो वैसे ही डिप्रेस्ड रहेगा। ये तो नॉर्मल लोगों के लिए भी है, तो ये तो ऑल ओवर सिचुएशन आई है। मैं कम्युनिटी से तो इससे डिप्रेस्ड है ही, क्योंकि अगर किसी का सोर्स ऑफ इनकम ही बंद हो जाएगा तो लोग खाएंगे पिएंगे कहाँ से? आपको गवर्नमेंट कितना राशन प्रोवाइड कर देगी? आप कितने साल तक खा लोगे, कितने महीनों तक खा लोगे? कम्युनिटी को सिर्फ एक ये तो नहीं है, दूध भी चाहिए, बेसिक फैसिलिटीज भी चाहिए, गैस भी चाहिए। सिर्फ एक राशन देने से तो कुछ होगा नहीं ना मैम। एक स्टोरी बताई, क्योंकि जैसे आप सब लोगों से नहीं मिल पाएंगे, जैसे कम्युनिटी के ना मेरे, तो मैं एक वॉलंटियर होके मैंने आपको सबकी बातें बता दी कि उसके साथ ऐसे हुआ वैसे हुआ, तो मैंने आपको एक पूरी मूवी दिखा दी। तो मैं यही कहना चाहूंगा कि कम्युनिटी की बात को सुनना और उस पे कुछ ना कुछ आउटकम होना चाहिए मैम, तभी जाके कुछ होगा। वरना कम्युनिटी तो सफर कर ही रही है, चेंजेस आ रहे हैं, ऐसा नहीं है। क्योंकि जब आपका सेल्फ केयर वाला हुआ था तो हमने इस चीजों पे काफी मीटिंग्स भी करी थी, और आपके सेमिनार्स भी हुए थे, मैंने भी वो अटेंड करे थे। तो मुझे काफी अच्छा लगा था कि एक हाई लेवल पे भी इस बात को डिस्कशन हो रही है। इसका मतलब ये बातें उठ रही है कहीं ना कहीं, लोगों के मन में सवाल आ रहे हैं। तो बस यही कहना चाहूंगा कि इसका आप मतलब चाहे किसी भी लेवल पे आप इसको आगे लेके जाइए, लेकिन थोड़ा सा इसका कुछ आउटकम निकालिए। मतलब ये बात कहाँ ही तो पहुंच पाए, क्योंकि मेरी देखिए मेरी आवाज कहीं नहीं जाएगी, क्या पता आप जैसे जुड़े हुए जिन लोगों के साथ आपकी आवाज आगे तक जाए। अगर आपकी आवाज पहुंच गई तो समझो कि कम्युनिटी की आवाज पहुंच रही है आपके साथ। आपकी आवाज के पीछे कितने हजारों लाखों लोगों की आवाज पहुंच रही है।
For playing that. See you all until the next time, maybe the coming month, where we will plan for one more webinar, and we will invite you as the participants. Thank you so much.